Assalamu alaikum everyone. Welcome to my YouTube channel. In today's video, we are going to discuss about BPS certification and whether this certification is required or necessary. So I hope after this video, you will get a clear idea about BPS certification, whether you need it or not. In this video, we are going to talk about the benefits of having this certification as a pharmacist and what are the challenges and what are the things to be considered before going for this examination or before taking this certification. So let's get started. I know most of you have seen this, like in many of their pharmacists or international pharmacists, that after their name you can see PharmD, BCPS, BCACP, BCCP, and all that. So this is kind of additional certification which most of the clinical pharmacists pursue. So basically, BPS stands for Board of Pharmacy Specialties. So, if you are a pharmacist who is interested in specializing in a particular area of pharmacy practice, for example, I love oncology and I'm planning to work as an oncology pharmacist maybe for 5 or 6 years. So, yes, this certification is something which I can consider to show that I am someone who is expert in this field. So, if you are interested in such to specialize in a particular field of pharmacy practice, this is definitely something you have to consider. So, there are multiple specialties. When you go into the website, you can see different specialties there for specializing. And if you're interested in any one of them, this is something you can consider. This BPS certification is internationally recognized certification. It is highly valued in countries like US, Canada, and other developed countries. And having this certificate really shows that you are having that advanced knowledge, skills, and expertise in a particular specialized area of pharmacy practice. And yes, this is something which give you that confidence, competence, and you will be treating patients better than a regular pharmacist because you're having that knowledge and skill and you know how to handle that case scenario very well. This really enhances your professional reputation among doctors, pharmacists, nurses, and other healthcare providers. This really adds a globally recognized credential after your name. And talking about career advancement, yes, this is going to open doors for you to explore international opportunities. You're also getting a chance to expand your network by interacting with other BPS certified pharmacists. And in short, we can say this is something which gives you the value, prestige, pride, credibility, knowledge, skills, and patient trust, international recognition, and of course, that personal satisfaction value. It's like a personal goal to achieve. Now, let's talk about the challenges or limitations. Number one is the cost and financial investment. Yes, this is an expensive examination, and not only the exam, the preparatory work or the preparatory course is also expensive. So, if you are someone who is planning to take this, make sure you are having that finance ready for this. And this exam, once you get certified, your every 7 years you will have to renew your certification, and for this you will need to either take the examination again or get CPD or CEE points which is approved by the organizations which is available in their website, and this is also an expensive thing. So basically the renewal and recertification fees every 7 years add to the cost. So you will have to evaluate this, because if you're a pharmacist who's working in India or UAE or any other country where BPS is recognized but it's not like a mandatory thing, then you might have to analyze that whether this cost may feel disproportionately expensive compared to the local average salary that you earn. So basically you have to do that comparison and make a decision. And the second challenge or limitation here is the time and exam preparation. You will need to add a lot of time, dedicate a lot of time, and also have a proper learning strategy in order to pass this exam. It is a tough examination, of course. You will have to practice a lot of case scenarios and learn a lot of guidelines and evidence based practices. So in order to do that properly, you will need to dedicate fixed time for this. At least 6 to 12 months you will need properly to prepare for this. So make sure you're having that time. Like if you're someone who is working, you should make sure that your employer is going to provide you that time for preparation, and you can balance both your work and the time for preparing for this examination. Then yes, you can go for this. But if you're not having a proper plan here, then it might be more challenging and difficult. Talking about the eligibility criteria, if you are in US, there is PG like PGY1, PGY2 residency programs, and in UAE also some colleges offer this. It's a US based residency program, and if you're someone who has completed that, you are eligible. But most of the pharmacists who are working in India or Pakistan or any other country, they might require 4 years of relevant clinical experience in that particular area where you're planning to specialize, except for BCPS, that is board certified pharmacotherapy specialists. They require only 3 years, but other all specialities, at least they require 4 years minimum. So this is something to be considered. So you cannot write this like as soon as you finish your graduation. You cannot go for this. You will have to wait for at least 4 years, and you will need that relevant experience in that particular area. Next is the limited recognition. See, most of the countries, BPS, like countries like India or UAE, they really value this credential or this certification. It's really respected, but this is not something mandatory. See, most of the hospitals or clinics, in their hiring process, they just require their license and relevant experience. But if you have this, that doesn't mean that you're gonna get this job. It is like it's something which is upcoming. Maybe we don't know, like in future this could be something mandatory also. Most of the job requirements, they're asking for the basic license and relevant experience as a pharmacist. Whether this is really required in the place where you're practicing is something which has to be considered. Many employers may not offer that extra salary or pay just because you got both certified. So this is something which the organization decides, and this is not going to guarantee you that you're going to get a higher salary package. Now, talking about the maintenance, I told you every 7 years you need to renew this by getting a CE points or CPD points from approved providers, and this is actually costly. And you will need that, you have to be up to date with the evolving clinical guidelines and attend all the CPD points, because I think you will have to complete a specific hours to get that recertification done. And just remember, in UAE, you can see so many pharmacists having this board certification, but this is not a mandatory thing. But and this is not going to replace licensure exam. So you will have to take your licensure exam and have the relevant experience to work as a pharmacist here. But if you're having this is something like extra add-on, an extra credential, but not something which is mandatory. Now, talking about the return on investment, you are investing your time, your effort, your money, everything into this. So you have to make sure that you're going to get something back out of it. So this really depends upon where you are working as a pharmacist or where you're planning to work. So if you're someone who is considering advanced clinical pharmacy roles, you're going to practice in academia or clinical research, you're seeing yourself going abroad or US or Canada in future, then okay, this is something you can go for. But then if you are like confused, if you're confused that you don't want to specialize in a particular area, or you're not sure that you're going to work in that specialty for more than 4 or 5 years, then you have to reconsider taking this examination. Important things to consider here is, number one is your career goals. What are they? You have to understand your career goals. At least for 5 years, a decision like where you're planning to practice. So if you're planning to work in advanced clinical roles, yes, you can go for this. If you're planning to move even in academia, research, or this can be considered. Or if you're planning to migrate also, this is something which will add value. Next is we have to consider is the recognition in your region, how it is. And of course, the financial investment is something you have to consider, the time and commitment. And even before planning this, make sure you are eligible for this. For this, you have to go into the website and read the requirements and eligibility criteria. So all the information related to the BPS certification and everything, you can see so many videos related to this. And also you can go into the website and have a look, read all the information given there, and you can decide whether you need this or not. And I have added a free checklist that will help as a guide for you to understand whether you need this certification or not. So I hope this checklist will help you. And even if the checklist is going to give you a negative reason and inside you're feeling, yes, I want to take this, of course, you should consider it. And I hope this video is informative for everyone watching this. Share this video with your friends. Thanks for watching and have a nice day ahead.